actual cranial nerve exam. It's just to rule out that nothing's going on unusual in your brain before we look at running some other tests. And from what we've seen, we don't think so, but it's just something we want to rule out. Yeah. So, before we head back to the examination room, let me just get your basic information really quick. Okay, so 4 o'clock appointment. And what is your first and last name? Okay. And what is your date of birth? Great, okay. And what is your main concern, your biggest concern regarding your health right now? Okay. Definitely. So that's what we're here for, is to help you get some answers regarding that. So, and cranial nerve exam, I would say it's, out of all the exams that you're going to do, it's probably going to be the most relaxing and enjoyable. I've had some patients tell me that it's given them ASMR before. I don't know if you know what that is, but yeah, it's pretty enjoyable and it's fun to do. So we're just gonna head back now, and we are going to get started. Let me just check my cranial nerve kit to make sure that I have everything that we need here. Excuse me. Okay, let's see. Make sure that we have everything we need. Just trying to think. I think there's one more thing I was. Okay. Ah, here it is. I was looking for my pencil sharpener because my pencil's getting a little bit dull, so I'm just gonna use that really quick. Perfect, nice and sharp. Okay, so before we get started, the first thing we're gonna do is gonna involve measuring. But most importantly, I'm going to put on some gloves. So if you ever have a healthcare provider that is not wearing gloves, you can kindly remind them to, because it's necessary. Get 2 pairs of those, and these are a little tight on me. They take me an extra second to get on, that's why. Okay, there we have 1 pair of gloves. Or 1 glove. Just make sure. Okay. There we go. Okay, we are all ready to get started. Okay, so the first thing we're gonna do, just for me to make sure that everything about all the features of your face, especially both sides, that they are symmetrical. Because sometimes when we have patients who have had a stroke, sometimes one side of their face will be asymmetrical from the other, or one side will be drooping. So I'm just going to measure the first half of your face. Let's see. So this side, that side. Okay. Okay, everything looks good with that. The next thing we're gonna do is we're gonna test your eyes. So first, we're gonna do something where I test the pupillary light. The pupillary light reflex, which basically entails me shining a light in your visual field. But I just want you to just look straight ahead. You don't have to look directly at the light. So you can just look straight ahead, like you're looking kind of in the distance. Okay. Wonderful. Don't mind me, I have some allergies. I'm actually going to get rid of this gum. Okay, so because I got rid of some gum, I'm actually going to change my gloves just for the sake of cleanliness, you know, with all those different germs going around, you know. So yeah, so the pupillary light reflex looks good. Also too, like, usually I don't have long nails, but when you have long nails with gloves, it makes it a little bit harder. Actually, a lot harder to put them on. Okay. Alright. Now we're going to test the movement of your eyes. So this time I do want you to follow the light with your eyes. And no, I don't want you to turn your head. You want to follow it with your eyes. Like that. Okay. So first we're going to test side to side, okay? Side. 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 Okay. Now we're going to test up and down. Look up, 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 up. And then look down, 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 down. Look up, 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 up. And then look down, 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 down. Now we're gonna do diagonal. Up, diagonal. And down. Up. And down. And then the other side. This. Diagonal, diagonal. 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 And one more time, up and down. Up. Down. One more time, side to side. Side. To side. Beautiful. So, looks like everything with the optic nerve is looking good. And with the muscles of your eyes. So now what we're going to do is we are going to test facial sensation, okay? So we have 3 different things that you might feel on your face. You might feel something a little bit pointy. You might feel something a little bit sticky. Or you might feel, you might feel something soft and feathery, very soft. So be a little pointy, a little sticky, or a little light and soft. Okay, you ready? Okay, so I want you to close your eyes, okay? Okay, first one. What did that one feel like? Okay. Alright, next one. Close your eyes. Close. And what did that one feel like? Okay. Alright, last one. It could be the same or it could be just something different. But once again, I want you to close your eyes all the way. Close. Alright. Okay, what did that one feel like? Okay, great. Looks like everything with facial sensation is working wonderfully. That's kind of a fun sound, right? Okay. Now, we're just going to look at, actually we're going to see and make sure that your vision in terms of your sight from far away and close up is okay, as well as your ability to see color. So I'm going to use this pointer and I want you to tell me what color I'm pointing to. So you don't have to say the shade, but as you can see, the row with red, the first one is more red, whereas it goes kind of to like a reddish orange, yellow, orange. So for these, yellow would work, orange would work, red or orange or red. And then this row here, the green row, it's all different shades of green. And then the blue row, we have blue, purple, or red. Okay, you ready? Okay, what color am I pointing to? Good. What color am I pointing to? Good. Okay. What color am I pointing to? Good. And now from far. What color am I pointing to? Good job. Nice. Okay. You have some great vision. Okay, and then the last thing we're going to do, we're just going to test your sense of smell. So I'm going to hold up a couple different things to your nose, and you are going to tell me what they smell like, okay? Okay, so alright. And this way you have to close your eyes because I will be blocking the scent. So I'm going to take a little sniff of that. And what does that one smell like? What does that one smell like to you? Good job. Okay. Okay, now this one. Take a little whiff of it. There you go. What does Amazing. So the results of our cranial nerve screening, it says, no further testing is needed, so we can rule out that it doesn't have anything to do with your cranial nerves, which is the, sensations that are associated with different functions, different senses. So you are good to go on that. It's probably a relief that we don't have to look into neuro any further. Thank you so much for your cooperation and for being so lovely.